have another significant medical breakthrough to talk about this morning. Daraxonrasib is a new experimental drug that nearly doubled survival rates for some patients with advanced pancreatic cancer.
Dr. Zev Wainberg is the co-director of the GI Oncology program at UCLA Health. He worked on this study and joins us now to talk about this very important clinical trial. This is, as someone who has lost people in my life from pancreatic cancer, when you read something like this, it is amazing to hear about. Can you just tell us how impressed were you and what did the study show?
So this study, which we've known for a while, this drug works in a small percentage of people. Once we tested it and put it to 500 people and we saw the results last week, it was extraordinary. It really was something that we didn't expect the magnitude of benefit to be that much better than chemotherapy.
Wow.
Yeah, I understand when this was presented at the American Cancer Society, there was applause, which is something that doesn't happen, which goes to tell you the magnitude that this is going to have in the medical field.
People have been waiting for a breakthrough in pancreatic cancer for a long time. We've known that it's one of the deadliest cancers, and we've only had chemotherapy to treat it. And now we've got a new tool, and this will hopefully be approved shortly. But it is a paradigm-changing moment in the history of pancreatic cancer.
So what does it do? Why is this different?
So it blocks a protein. It's not chemotherapy, it's a targeted therapy that blocks a protein that is critical to the growth of pancreatic cancer cells. And for the last 50 years, we've known that that protein is important, but nobody's been able to develop a drug to block it. And so finally, a company, amongst many companies now motivated to do this, have been able to figure out how to block that protein directly with a pill.
This is really amazing. Okay, so something like this goes through the trial that you all did. You told me there were 500 patients in the trial. How long before you see this widely used with other patients?
Our hope and expectation is that this drug will be approved very quickly by the FDA. I think everybody recognizes how urgent the problem of pancreatic cancer is and how important it is to get it out to people. Not everybody can get access to clinical trials, and we know that. We've done the test. We've proven that this is better than chemotherapy in that group of patients. The next step is for the FDA, hopefully, to approve it very quickly.
You think the next few months or a year?
I'm hopeful. I hope way sooner than a year.
Wow.
Our hope is once you do this kind of randomized phase 3 trial and you prove it, then it's usually a pretty quick process.
Yeah. And it's not only the most deadly form. It's when you get the diagnosis, it can be just months. You have months to live. I mean, it's devastating for people. So what did this show? How much longer do people generally live?
So the first thing we did is we tested in people who had already been on chemo. We showed that it worked. It shrunk down tumors. It helped people live longer.
Wow.
This was the ultimate test, though. We split half the patients into chemo, half the patients into this pill, and the pill doubled their survival. So we are not saying that this is a cure. We're not there yet. But this is a dramatic breakthrough moment, and it's really going to lead to many more improvements over the next number of years in treating pancreatic cancer.
Yeah, I'm sure that's what many people who are watching are saying. What else could this possibly help with?
I think it'll help beyond pancreatic cancer, potentially in other cancers that are dependent on that protein, KRAS. But in pancreatic cancer specifically, we're going to start testing this drug, we already are, in earlier lines, prevention, after someone gets surgery to prevent it from coming back. So, you know, now I think the opportunities are dramatic to really move the field forward in a very significant way.
Also, you said, I just want to clarify, you said this could help some patients. I know you're super smart because you did this study. Help us understand which patients it could possibly help and which ones it might not.
I think in any treatment, we are careful to say it doesn't work perfectly in every single patient. But I would say in the large majority of patients with pancreatic cancer, this drug, once approved, will provide benefit.
Now, when it comes to cancer, a lot of times, you know, when people go through chemotherapy, it's so hard on people. Is this drug as hard? Does it make life worse? Are the side effects just as bad?
So one of the things we looked at is it make people feel better than when they're on chemo, and it did. So compared to chemotherapy, people felt better, but it does have side effects, and one of the more notable ones is a rash. That's something we're getting a handle on. We're figuring out how to manage the rash, how to deal with the skin side effects, but compared to chemo, it's a whole heck of a lot better, in my opinion.
This is wonderful. How long has something like this been in the works?
I mean, on some level, people have been working on trying to block this target for about 50, 60 years.
Wow.
And in the last 3 years, this drug started to be tested. And then about 3, 4 years ago, we started to see it in small groups of patients. And, you know, the doctors involved in this project are like, oh my gosh, we're onto something here interesting. And then, you know, the 500 patient study enrolled over about a year. And then the results were just announced last week. So it's a multi-year project, but very fast as far as drug development works.
Yeah, absolutely.
Big fan of science, big fan
I know.
of the
We
research.
call a lot of people heroes, but you're truly
Yes.
one of them.
Thank
so
you
thank
for
you
the work
being
you
with
do.
us. Yeah, I know who will also think that, are Kalina Strinos. Both of us lost our fathers to cancer. She lost hers to pancreatic cancer. So I do want to give her a shout out because I know news like this really touches people like her.
Yeah, I mean, really, the patients, their families that participate in these things, that came to our center at UCLA and really all around the country, all around the world, gave themselves, their families, their supporters to come participate in these trials without knowing what would happen. So,
Right.
I mean, they deserve most, if not all, the credit here.
Absolutely.
Well, thank you for the work that you do. We really appreciate you.
Thanks for having me.